Hello everyone, and thank you for joining us today. My name is Cheryl Fatibene. I'm the Chief Nurse Practitioner Officer at the NNCC, and on behalf of the National Nurse-Led Care Consortium and the AANP, I would like to welcome you to today's Lunch and Learn webinar, The Science of Joy and Burnout, presented by my colleague, Joseph Reyes, who is a program specialist at the AANP and a collaborator with the Nurse Practitioner Support and Alignment Network. Today's webinar is being recorded and will be available in the upcoming week on our NP-SAN portal page, and a link to today's recording will be sent to all of those who have registered. All participants will be muted throughout the presentation. I encourage you to submit questions during the presentation. Please use the Questions tab on your GoToWebinar control panel as seen here if you have a question. It will be relayed to the presenter and answered at the end of the webinar. A survey will pop up at the end of the webinar and be sent in an email later today. Please take a few minutes to complete this survey, evaluating the activity, as your feedback is critical to the ongoing development and presentation of our webinars. The slides for today's webinar are available as a handout. Let me take a quick moment to talk about the national investment taking place for quality improvement in the United States with the help of our federal government and the organizations who are presenting this content as part of the Transforming Clinical Practice Initiative, which is sponsoring today's presentation. The Transforming Clinical Practice Initiative, or TCPI, is CMS's largest ever investment in practice transformation, with an investment of more than $700 million over 4 years and an enrollment of 150,000 plus providers across the country. The NNCC, or the National Nurse-Led Care Consortium, is a membership organization with over 250 nurse-led practices on our membership roster. Our mission is to advance nurse-led care through policy, consultation, and programs to reduce health disparities and meet people's primary care and wellness needs. Our partner in this initiative, the American Association of Nurse Practitioners, is the largest full-service national professional membership organization for nurse practitioners of all specialties. It is leading the way in advocacy, continuing education, and professional development for over 76,000 members. CMS has funded the NNCC and the AANP to support enrollment of NPs into practice transformation networks, or PTNs, across the country, and to develop NP-specific educational material that facilitates practice transformation in advance of upcoming payment reform changes with CMS. The NNCC and the AANP are the only nursing-focused grantee of the TCPI project. The AANP and the NNCC agree that this initiative is important to ensure NPs receive the support they need to remain competitive in a changing healthcare landscape. NPs are the future of primary care in the United States and already provide high-quality and cost-effective care. This initiative is an opportunity for NPs to prove it by helping CMS and the broader healthcare community build the evidence based on practice transformation while preparing for value-based reimbursement. How do we prepare NPs for upcoming value-based reimbursement? We want to use this program to prepare clinicians across the country for payment reform under MACRA, the Medicare Access and CHIP Reauthorization Act of 2015. Many of you have probably heard of MACRA. It's legislation that was passed to establish Medicare's Quality Payment Program, or the QPP. Under this quality payment program, there are 2 payment adjustment mechanisms to incentivize quality tied to Medicare Part B payments: MIPS, or merit-based incentive plans, as well as advanced APMs, or advanced alternative payment models. Most clinicians will end up associated with MIPS, or the merit-based incentive plan. MIPS involves 4 elements that clinicians need to demonstrate successfully to maximize their Medicare Part B payments. These elements are quality, resource use, identifying clinical practice improvement, or CQI activities, health IT. If you can demonstrate these 4 elements in your practice, you will succeed in a value-based payment environment. We know NPs have a large growing role in the delivery of health care, especially primary care. The NNCC and the AANP want to connect NPs to TCPI-funded practice transformation networks, or PTNs. These peer-based learning networks have the responsibility for enrolling and supporting clinicians. They provide free boots on the ground, technical assistance, and services that help realize practice transformation. How can we as NPs help PTNs by serving as leaders in their networks? NPs have experience working in collaborative, interdisciplinary, team-based environments and can be leaders in this movement. So that brings me to our presentation today, The Science of Joy and Burnout. I'm going to turn the presentation over at this point to Joseph Reyes. Joseph?
Well, hello everyone. I want to thank everybody for your time for attending this presentation. I just wanted to make mention of anybody who is participating in this webinar today. If you had been affected or have family members who have been affected by Hurricane Harvey, AANP is based in Austin. I have family in Houston, and several were affected by the hurricane, and so I wanted to extend our deepest condolences to anybody who may have been impacted by the hurricane. That being said, I do want to today discuss a very important topic with respect to healthcare, especially the joy experienced in healthcare. It's titled The Science of Joy and Burnout, and today's objectives, if you go ahead and advance the slide. So primarily, we are going to review the scientific literature on burnout. And you will notice that burnout and joy, or the lack thereof, are closely related. As such, we are going to discuss how joy can systematically improve healthcare. And then we're going to review some workforce vitality improvement tactics. It's just a very fancy way of saying there are some actions that people can take to improve the experience of joy in healthcare from a system-wide standpoint and from an individual level. And at the very end, we're going to give the audience, everyone who's on this call today, the opportunity to answer some joy-related satisfaction measures. And we're going to be able to compare those measures to some specific data points that we have on this presentation and that AANP has required and HRSA has acquired through some of their national sample surveys of NPs. So to begin the discussion, we'll go ahead and move to the next slide. Let's talk about joy. So there are, if I were to ask the question, what is joy to any particular individual, there's going to be a significant amount of diversity in the response. But with respect to academia, one of the more leading perspectives on joy is from the psychiatrist George Valent, and he's a professor at Harvard Medical School. And the way he defines joy is really based on the difference between the sympathetic and parasympathetic nervous system. And so he talked about the sympathetic nervous system being acutely related to the experience of happiness, which is a really strong emotion that we experience throughout the day, sometimes on a whim without even really understanding why or how that emotion of happiness arose. And then he talks how joy, unlike happiness, is unrelated to the sympathetic, but the parasympathetic, which is primarily responsible for resting the nervous system. So his official quotes there, but essentially, happiness activates the sympathetic, joy would activate the parasympathetic. Joy, unlike happiness, is a little bit more about connection. Happiness would displace pain, but joy embraces it. So there's a sense of connectivity, or this feeling of connectivity when you're experiencing joy. Unlike the academic perspective, there is some mainstream diction where, like, for example, in Merriam-Webster dictionary, joy is defined as the emotion evoked by well-being, success, or good fortune, or it is the prospect of possessing what one desires. And so, as you can tell, that's a very different definition compared to the academic, where we are actually talking about systems that occur in the body that create emotional responses. And when those emotional responses are delineated, one is associated with restfulness and the other is associated with activity, or the sympathetic aspect of the nervous system. So that does bring up an important question. We'll go ahead and move to the next slide. So how is joy defined by the quality payment program? And as you briefly heard my colleague Cheryl Fatabene discuss the quality payment program, and in this program there is a definition of joy. We'll go ahead and move to the next slide. So joy is primarily defined by the Transforming Clinical Practice Initiative Change Package. Now this change package, it will be available to anybody who's interested in acquiring it. It's a very lengthy document, about 32 pages, maybe even longer. I think it's 32 to 33 pages long, but it contains a curricula of sorts that, that break down various components of healthcare, one being related to joy, which is sustainable business operations. And within the sustainable business operations category, they define it as a successful business operation would be seen through positive patient experiences and staff that experience joy in their work. And then in addition to that, resources for investing in the practice's future. And if you go through that change package and you pinpoint the exact location of the workforce vitality and joy in work curricula, which they define it as 3.2 and 3.2.3, which is a driver and a subdriver, there's a whole list of what they call change tactics. These are essentially actions that we should be taking in healthcare consistently, continuously, persistently in order to increase positive patient experiences and to increase joy in work. And you know, the primary emphasis here is that the more you use the change tactics, or the more you act in such a way that promotes joy, you will find that your patients will have better experiences. And that's the argument that I am making today on this webinar. And so given this understanding of how the quality payment program defines joy, I do have a working definition that I've personally created, and it's based off of this perspective of change tactics. And so if we'll go to the next slide. So I've defined it this way. Joy in healthcare is defined by a system of actions that support long-term workforce vitality, leading to positive patient and clinician experiences. So that's essentially the basis of joy, is that if you as a healthcare institution, or as a primary care clinic or a primary care practice, are having patients that are experiencing positive outcomes, and your clinicians are joyful and connected and feeling satisfied, well, that's essentially the definition of joy, that your practice experiences joy on a daily basis. So we'll go ahead and move to the next slide. Now that brings up the next question, which is the antithesis of joy being burnout. And how is burnout defined by the scientific literature? And I think, again, if I were to ask everybody on this webinar what burnout is, I think you could clearly define it. You can clearly see it. You know it when it's occurring in your own body. You know it when you see it occurring in your fellow colleagues. It's almost this intuitive experience, this intuitive response to external stimuli and factors that you as a clinician and practitioner are dealing with on a day-to-day basis. So to begin, in a similar fashion to joy, I want to look at some specific definitions in the literature. So we'll go to the next slide. So Freudenberger in 1974 defined burnout as a state of fatigue or frustration resulting from professional relationships that failed to produce expected rewards. And I think that's a very astute definition, and it's very applicable and to this very day. If you go into your workplace and you have an expected set of rewards that you are anticipating from your particular job and scope of work as a working professional in healthcare, and you do not receive those expected rewards or experiences, you will more than likely experience burnout. Well, about 8 years later, Maslach Maslow, he defined burnout in a little bit more of a definitive fashion. He said burnout is a prolonged psychological reaction to chronic emotional and interpersonal stressors. And they're defined by three primary aspects: emotional exhaustion, depersonalization, and reduced personal accomplishment. And so you can see that those two definitions closely align. And if you're not familiar with depersonalization, because when I first heard this word, it is sort of a fancy word, but essentially it's a level of detachment from one's self, and then also from one's working environment. And so if you're detached, things become vague. Experiences become less real, and they lack significance, especially within your workplace setting. And so that might lead somebody to provide less than optimal care to their patients, or less than optimal attention to the patient in front of them as they're explaining their problems or symptoms. And now that we have this understanding between joy and burnout, that burnout is the antithesis to joy, it brings up the next question: is what is the relationship between joy and burnout? So we'll go ahead and move to the next slide, and then we'll go ahead and continue to the next one. And so what is the relationship between joy and burnout? And I've described it as the antithesis, that joy or burnout is the antithesis to joy. And that seems very common sense. I wanted to describe this relationship using Euclid. Euclid was a Greek mathematician. He was born in the mid-4th century, roughly. It's an estimate. No one really knows, but it's based off of other individuals who were alive during his time. But he developed a system of geometry that's based on axioms, or it's axiomatic. And all his theorems are derived from smaller numbers of axioms. And as part of the axioms, he developed the 5 common notions. And the first notion is actually listed at the top above his photo. It's in real small print, unfortunately, but essentially his first axiom is: things that are equal to the same thing are also equal to each other. So how does this translate? So extrapolation of this first axiom and applying it to the problem of burnout allows everyone to see that decreasing joy equals increasing burnout, because both of those are equal to dissatisfaction. So if decreasing joy is equal to dissatisfaction, and increasing burnout is equal to increasing dissatisfaction, lack of joy and burnout are equal to each other. So X equals Y. It's a very simple mathematical equation. It's a bit of a reach there with respect to the concept that I'm trying to communicate. But I thought it was a good way to show the relationship. So anytime you talk about burnout, it means there's a lack of joy. Anytime you talk about lack of joy, it's literally meaning there is increasing burnout, or the feeling or experience of burnout that may lead to somebody leaving their job. So they are essentially equal. Let's go ahead and move on to the next slide. And so in a similar fashion to my definition of joy, what would burnout be from the standpoint of its definitive its definition? And it's the opposite. So burnout in healthcare is defined by a system that lacks appropriate actions that support long-term workforce vitality, leading to negative patient and clinician experiences. So 2 arguments I've made: joy being a system of actions that support long-term workforce vitality, and burnout being its opposite, a system of actions that lack, or a system that lacks appropriate action that support long-term workforce vitality. Now, you could say, or you could ask, well, this seems like your perspective, your opinion. Well, it turns out, if we want to move to the next slide, the quality payment program was not built based off opinion. It was built over a significant period of time, and the change tactics that are listed were considered based off of extensive study, qualitative and quantitative. And so there is a significant amount of research to support the emphasis of a particular system of actions that lead to positive patient experiences, and thus more joy in work on an individual and a system-wide level. And so what we're going to do is we're going to get into that research in particular. And so keep in mind that from this point on, because I'm presenting research, of course, this is, essentially what the literature shows to be the most accurate and factual representation of the experience of burnout. So it's no longer my opinion. It's the scientific viewpoint of what burnout is and what joy is in relation to burnout. So this first research study is actually a very profound study. It was published in February of 2017, so very recently, so it's very applicable. And by the way, let me mention, a lot of the research right now on burnout is related to clinicians and in particular nurses. So nurses who work in hospital environments is in that experience of their scope of work and their day-to-day stressors is significantly different from like the primary care clinic, of course, or maybe even related as well. But the research is sort of limited to nurses, but the principles that come out of this literature are universally applicable. They apply in all settings, whether you're in a medical profession or not. They apply in every workforce environment. But for this particular webinar, you will find that the studies that I'm presenting are more nurse-related than nurse practitioner-related. But there is some ongoing research being conducted on nurse practitioners that is in the near future. So for now, just bear with me as we talk about the results of how burnout plays out within the nurse community. And so in this particular study, published in February, there were 10 studies that were included in the systematic review. 4 were cross-sectional studies. The remaining were descriptive correlational studies. But what this study found is that a good work environment constitutes a determinant factor for high-quality care, and at the same time, it leads to improved outcomes for the nurses. And so how do they define a good work environment? Well, they defined it as good professional relations, a supportive management style, a balanced work schedule. The load of work was congruent with the level of skill for that nurse. There was adequate patient time. There was opportunity for autonomy. There were resources available, and there was professional advancement also available. Now, this is a fantastic study because it outlines the importance of the system being healthy. If the system is not healthy, then you are less likely to have joyful employees. You're more likely to have burnout parading itself around, so to speak, throughout the department or throughout the ward or the office. And burnout's a very sneaky enemy. And if you're not looking at the cause of burnout from a systematic standpoint, you're going to be missing some key opportunities to remedy its causality. And so overall, patients who were hospitalized in units with respect to this particular study, with good work environments, all those attributes listed were apparent and realized. Those nurses were more satisfied with the nursing care. The patients were more satisfied with the nursing care than patients who were being served in poor work environments. Nurses who perceived their work environment to be good experienced higher job satisfaction and lower rates of burnout syndrome. So that's what this one piece of research says that was published this past February in 2017. So we'll go ahead and move to the next piece of research. Excuse me. All right, so this particular piece of research here was conducted in Thai hospitals. So a lot of this research is very well represented across the world, which is good, but it was published in January 2016, so not too long ago. It is a cross-sectional analysis of data from about 2,084 registered nurses working in 94 community hospitals across Thailand. The data was collected through a survey questionnaire that included the burnout inventory developed by Maslow, and the measures were focused on perceived quality of care and patient outcomes. And I've summarized it here that when burnout is high, the quality of patient care and safety significantly decreases. So there's an increased incidence of higher patient falls and higher patient infections. But specifically speaking within this study, for every unit of increasing emotional exhaustion that was scored, there was a 2.63 times rise in reporting fair or poor quality of care. There was a 30% increase in patient falls. There was a 47% increase in medication errors. And there was a 32% increase in infection. So the clinical relevance here is that hospital administrators, nurse managers, nurse practitioners, health leaders need to create favorable work environments. Again, the concept of the focus on the system. If the system is not favorable, it's going to lead to detrimental outcomes for the clinicians, for the practitioners, and for the patients, and sometimes to the demise of their own patient safety. We'll go ahead into the next piece of research. This one was published in January of 2017, essentially titled Predictors of Burnout. And I think at this point we could probably predict it on our own, but in this case, this study showed that it was published January 18, 2017, that some of the more prominent predictors of burnout are high workload, a lack of autonomy, emotional exhaustion, poor social capital, and hospital nurse management. And so how is social capital defined by this study? And essentially it's, if there's poor social capital, there is a lack of trust between clinicians. There's a lack of trust between practitioners. There's also an unfavorable work climate as that lack of trust ensues. And there's also a lack of shared values between practitioners when there's poor social capital. With respect to high workload, that is, I think we all understand what a high workload might mean to us individually, but how the article defines it is that most of the time the practitioner is doing a lot of work, and most of the time the practitioner's work that they're doing is very difficult. And most of the time that the practitioner is doing a lot of work that's very difficult, they do it in a short amount of time. So that's essentially how high workload is defined. And with respect to hospital and nurse management, how this particular article defines it is that there is, let's put a positive spin on it, because I seem to be focusing on the negative. But if there is a healthy amount of hospital nurse management going on in the system, there is a chief nursing officer, there is a chief nurse practitioner, there is some clinician who is highly visible and accessible to the staff, that they have an administration that listens and responds to employee concerns, and that staff nurses or clinicians or practitioners are involved in the internal governance of that hospital or of that department, and that's very important. So predictors of burnout: high workload, lack of autonomy, emotional exhaustion, poor social capital, and nurse management. We'll go ahead and move on to the next piece of research. Now, I'm sure everybody has noticed that there has been this increasing trend of speaking on emotional intelligence, or what they call EI. It's even been called, emotional intelligence quotient, or there's even like a social intelligence quotient. It turns out there is some research with respect to the nursing practice on emotional intelligence, and this particular piece of research was published in December of 2016, and the results suggest that increasing emotional intelligence might critically decrease the nurse's turnover intention by reducing the effect of emotional labor, or the stress of one's emotions, and on those emotions interplaying and interweaving itself in the experience of burnout and in the practice. If you do a simple book search on Amazon, you'll find there's all these new books about emotional intelligence, and so what you might find is that And from my own personal experience of understanding emotional intelligence and reading about it, it's not that emotional intelligence is a lack of emotion. It's that the emotions are present, but the emotions don't highly affect how you make a decision with respect to your job or with respect to a problem in the workplace. And so that's how emotional intelligence can be understood. And in addition, there was a mediation effect between somebody or between those who had high emotional intelligence and the experience and the effect of emotional labor and burnout. So I think this is a really important article to consider how our individual experiences and how we bring those individual experiences and emotions into the workplace, specifically those emotions, and how we manage those emotions and how we allow those emotions to allow us to make certain decisions and whatnot. You can even get to a whole other conversation about the role of emotion and reason and whether you can separate reason from emotion, and is that possible? And that's a whole other discussion in and of itself, so we won't get into that. So on to the next study. This particular study was published in September of 2016. It is a descriptive correlation design. It was used in stratified random sample of about 100 nurses recruited from 2 Spanish hospitals. And so what they're showing in this particular study is that social support is a significant predictor of nurse engagement. So if you feel socially supported, if you feel socially a part of your work environment, it's going to predict how engaged you are in your job, and that level of engagement is going to moderate the relationship between your job demands, your scope of work, and your experience of burnout. And those processes are not isolated processes. So the process that leads to burnout and the process that leads to engagement are not isolated by any means. They are connected. So if you have a significant amount of social support and you feel on a day-to-day basis respected by the staff, respected by your own colleagues, you feel connected to your patients, you feel you're making a difference, you are more likely to be engaged. If you're more likely to be engaged in your work, it will moderate the relationship between your perhaps high job demands and scope of practice and its relevancy toward the experience of burnout. And so, again, we're just sort of repeating some main principles that were mentioned at the very beginning of this presentation, that there are a set of actions that can be taken to prevent burnout and to increase the overall systematic environment of the place that you work. And again, you can even tie lack of engagement to burnout. So if there's increasing lack of engagement, there's going to be increasing burnout. And that kind of goes back to Euclid's axiom. This next piece of research it's not an official piece of research published in any nursing journal. We'll go ahead and move to the next slide. It was published by the by the Cicero Group. It was commissioned by the O.C. Tanner Institute in 2015. And I'm including this piece of research today because I think it will highlight a very important aspect of the workplace experience that often gets overlooked, and that would be the role of recognition. And so in this particular study, this institute asked a bunch of people, what is it that causes you to produce great work? What makes you work better? What makes you provide better results, a more quality deliverable? And you can see by these pie charts here, the most important drivers of great work are listed. And among those, a promotion really only produced about a 4% response rate. Training was 6%. Getting paid more only represented 7%. Autonomy was about 12%. Inspire Me was 12 too. And then there, of course, a certain subset of that population that just feel self-motivated and say, well, nothing's going to help me. I'm self-motivated no matter what. But a large percentage said, recognize me. Recognize my work. Recognize when I perform well, and it will encourage me and help me to continue to produce great work. And then they sort of spun the question around. They said, if you were a a leader in your department, or if you were a manager or administrator, what would you do to produce great work in your employees? And again, the primary response was I would recognize them. And of course, the other one, fire them, train them, pay them more, lead by example, give them more autonomy. All those were secondary compared to the emphasis of recognition. And recognition maintains and inspires great work. And it's even listed in the Transforming Clinical Practice Initiative Change Package, which of course was developed over a period of time based off of a significant amount of research and qualitative feedback in the field from all types of practices. So the role of recognition is important. We can't forget that as well. Recognition also, as a last bit, as a last statement, recognition is really important in encouraging retention of employees. So if you exist in your workplace and you have never been recognized, or you hardly receive any level of recognition for the work that you do, it's going to weigh on you. And I think if we get down to it, we're human beings. We are emotional creatures. We are rational creatures, and there's this constant interplay between the rational and the emotional, and that relationship plays out differently for everybody. But if if our basic human needs as emotional beings, as rational beings, are not being met, then it's no wonder that it affects how we act and how we produce results in an artificial environment like a workplace, which is something that we've created and developed, and through human ingenuity and through economics and whatnot. But if those basic human needs are not being met, then there's going to be some detriment to that, or detriment experience. So the next piece of research that we have, we're getting down to almost toward the end of the research, but essentially this one is just a nail in the coffin. It's nurses working in the university hospital with good work environments had significantly less job dissatisfaction, attention to leave, and burnout. So that was published in March 2017. So that's the nail in the coffin. To move on, most of this research here, I'm representing everything that I've already talked about. So all this research relates to the change package and the tactics listed at the very beginning of the presentation, which are, as you can see here, listed, emphasizing development and training, conflict resolution, encouraging staff retreats, promoting kindness, celebrating successes. So all of these are represented in the literature. If we go to the next slide, again, in these two pieces of research relate to success from a business standpoint is seen in positive patient experiences and staff that experience joy in work. And so what we're really getting down to, what the literature is saying quite simply, is that, go ahead and move to the next slide, is that the more change tactics that you use, the more actions you take with respect to what has been identified to work, you're going to see increasing joy, you're going to see decreasing burnout, and you're going to see better health care, better patient safety, higher job satisfaction, etc. It's just the way things work with respect to how humans operate in a work environment, and how the emotions interplay with the rational mind, and how a system that promotes healthy emotional experiences and healthy rational experiences leads to more joy and less burnout. And so the conclusion here, this is a very robust slide, the conclusion slide, so there's a lot that's being said here. I won't repeat it verbatim, but essentially we need to recognize the value and importance of joy in business. We need to recognize the value of creating that system for joy to be realized, not just to be thought about or to be imagined or to be talked about, but it needs to be realized. And then we also need to maintain that system indefinitely. And if you're not maintaining it, you're missing the point. So joy is an investment. It's not an immediate transaction. It's not something that you just tell your employees to experience and change, or be more happy, be more joyful. And from a work environment standpoint, it's not how it works. Science says it's about the system. Create the system that maintains joy, that promotes joy, and your employees will experience joy, and the patients will be better for it. And so as a way to close out the research, I wanted to conduct a small poll for everybody in the audience. I wanted to start with two particular questions. The first question has to do with autonomy. So Cheryl or Tiffany, if you could help me with this polling process, that would be great. But I'd like everybody to be involved. So for the poll, I'm going to ask you, and everybody please answer this question, no matter where you work, whether you're an NP or a nurse or a medical doctor, are you satisfied with your level of autonomy in the workplace?
And we have poll results coming in right now. We're going to give it another few seconds here.
Great.
So what we have here, Joseph, is in terms of polling results, we have 36% were very satisfied, 47% were satisfied, 14% dissatisfied, and 3% very dissatisfied.
Okay.
So mostly satisfied, but very satisfied.
Yeah, good. We have about 83% that are very satisfied or satisfied. Okay, so the next polling question that we're going to conduct, the question is, are you satisfied with your overall employment at your main NP practice site? So that's going to be the next question I'd like for you to ask.
And the results are coming in here, and just so everyone knows, they're anonymous. Another 5 seconds or so.
Okay.
And it looks like we have results here. So for the question, are you satisfied with your employment at your main work site? And it's 23% are very satisfied, 44% satisfied, 27% are dissatisfied, and 6% are very dissatisfied. So again, the majority is still in the satisfied, but we have a higher number here of dissatisfaction.
Okay. Very interesting results, and the reason why we conducted those two particular questions is because there are some research out there that talk about level of autonomy and also level of satisfaction at your main practice site. And so we'll go to slide 31, please. So this particular sample, this is a 2012 HRSA national sample. It was conducted primarily for NPs, and so we're just going to have to make do with respect to the data comparison. Not a perfect world, but 92% of the NPs were very satisfied with the principal position. But what I really want to focus on is level of autonomy. There's about a 90% satisfaction rate, very satisfied or satisfied with the level of autonomy, a little bit over 90%. And this particular poll on this webinar was about 83%, which isn't far off from the 2012 HRSA national sample. Of course, it's 5 years ago, so that might have changed since then, which is interesting to say the least. And the next piece of research is actually provided by the American Association of Nurse Practitioners. This was conducted in the 2016 A&P National Sample Survey. Overall, about 86.3% were satisfied or very satisfied with their employment at their main NP practice site. So this is NPs only. I'm not going to make the assumption that we have an entire group of NPs on this webinar, so we'll make do with the data comparison. But this particular question, only 67% on this webinar showed a level of satisfaction that was either very satisfied or satisfied. So that's actually very surprising to me. And I thought it would be useful to conduct these polls just for some real-time gauging and an estimation of how our audience is experiencing joy or the lack thereof in their workplace. So hopefully, the point of this presentation is to get you thinking about joy and how how it interplays in your work environment, and what joy means to you, what joy means for the department. If you're an administrator, how can you start creating a system for joy? How can you maintain that system indefinitely? And then how can you, from the starting point of getting the buy-in from the top, trickle down that system all the way down to every employee possible, so that we are, all fully engaged, supported, recognized, healthy, joyful, and then most of all taking care of our patients. So the next slide, just my reference slides there, but I wanted to go ahead and we're at the 45-minute mark, so I wanted to open up the opportunity for questions if anybody had questions with respect to the research presented or any of the concepts that I discussed today.
Okay, thank you very much, Joseph. That was really great information. Just a reminder to everyone here that we will pause during the presentation and we will take questions through the chat box. A reminder as well that the handout for today's presentation is available in the Handouts tab, which is kind of located towards the bottom of that pane on the side for the webinar. And you will be sent a link with a recording of today's presentation by email, I think a day or so after the presentation has concluded. So those tend to be the questions we get the most. One question that I have, I just wanted to throw out to the group, and wondering if anyone has any particular examples, either good or bad, of joy within your place of work. And we can take you off mute if you wanted to raise your hand, and you can ask your questions.
I also wanted to reemphasize that the Transforming Clinical Practice Initiative Change Package, the document that we discussed in today's webinar, is available. We can easily send it to you guys if you want to. There's going to be some contact information listed shortly, and you can simply contact Cheryl or Tiffany, and they'll be able to send you that document in its entirety, which includes an entire list of tactics related to workforce vitality and joy.
We had a question from Barbara. Barbara, you had raised your hand. Are you still with us? We're going to take you off mute if you'd like to ask your question. You are ready to go, Barbara, if you're still there on the line and you'd like to ask a question. Barbara M. I don't think we have Barbara. So we do have some questions that are coming in right now. Joseph, I'll read these off to you. So we have one from Sandra asking about any polls showing compensation range for various types of NP specialties. And I do know that the AANP does some work around that with salary ranges. And I know that they have done publications, I think it's the Pearson report, once a year does an overview of that. So I don't know, Joseph, do you know anything else about where to find that information?
I do. In fact, the research department at the American Association of Nurse Practitioners recently conducted a compensation survey within our membership. So that survey is currently being worked on, and it's going to be one of the more up-to-date representations of compensation within the nurse practitioner profession. So stay tuned for that. I'm sorry, Sandra, if you'd like to send us an email, I can be sure to keep you in the loop on that particular question and when that official report is released.
Great, and we'll put up our email addresses here as well. We don't have Joseph's email address on the slide deck, but you can send them to us and then we'll forward them on. So we have a question also from Sandra C. What if any influence do you think technology has on joy? Electronic health records, email, beepers, phones, etc. Your thoughts, Joseph?
That is a very good question. I know with respect to my job position and the NPs that I have spoken to at or just heard speak on the role of EHR in the patient experience, I've heard some back and forth on how the EHR system and the now requirements that are being imposed upon anyone who sees Medicare Part B or who works with CMS, the amount of data that is required to be reported, the amount of note-taking required to be reported and recorded in the EHR is deterring the patient, the clinician from adequately interacting with their patients. And so I know that that would have somewhat of a detrimental effect on the experience of positively impacting the patient in the clinic. I do know that the HRSA sample, national sample, I believe talked about EHR. Let's see here. I mean, it was generally described as the amount of paperwork required. And so I can only assume that that might be related to the use of EHR. But in that particular question, the satisfaction level was, I mean, it was relatively still high. I mean, so most people were very satisfied or satisfied up to about the, actually, I'm sorry, satisfied. Yeah, so there were more people who were just, satisfied with the amount of paperwork required or the amount of data collecting that's required, and there was about 15 to 20% of that sample were very very dissatisfied. And so I would say it does play a role in how that EHR is implemented and how it's managed and how it contributes to the patient experience, and usually that's on a case-by-case or clinician or office-by-office basis, depending on whether or not you're using an EHR system, how advanced that EHR system is, how easy it is to use, how well trained the clinicians are in the office on this EHR system. So there's a lot of factors there that come into play, but I didn't see any particular data points on EHR specifically in its relationship to burnout, unfortunately.
Well, Joseph, we've had a floodgate of questions, so I am going to start reading them off to you, and we still have a few minutes left here. I'm hoping we can get to everyone, so we'll try to get through these quickly. The next one is from Angela. She's wondering about 2 suggestions you would have for increasing joy for yourself quickly. What are 2 quick things that somebody could do?
Oh, man, that's another great question. How to increase joy for yourself in the workplace, I'm assuming?
I would say,
just in general?
I would say probably joy in general.
Joy in general. I would have to say to take a moment, for one, take a moment, stop, focus on your breath and on the environment around you. So I like to do this out in nature. That's one easy way to do it. So you could be like outside, sit on a park bench or go somewhere where there's trees and stop, focus on your breathing, experience your breath, experience nature, hear the trees sway in the wind, hear the birds chattering, feel the air rushing past your face, and focus on the breath for 10 breaths, and try to connect with this experience of just being alive and being present, and being healthy, assuming you're healthy. And then secondly, for me personally, again, this is just anecdotal for myself, but trying to get away from the distractions of daily life, which a lot of it comes from our engagement with technology. So finding a way to remove yourself from a technological stimulus for at least 20 to 30 minutes to just be present in your body and whatever you're doing in front of you, I think is a really good way to calm the mind and allow you to experience that parasympathetic experience, as George Valiant talks about, where you're resting. You're not in this fight or flight experience. You're in this restful state of presence and of being wherever you are.
So in the interest of time, we're going to keep moving here and get another question here from Judith asking about RNs working in a very busy ED and the emotional aspect of care when you're caring for patients that are under extreme stress and the cause of exhaustion and burnout, and suggestions for identifying it in yourself as a provider before you get too burned out.
So I would think the first thing I would suggest is to reflect personally on your level of emotional intelligence, and that's where do you begin with that, and how do you start that process? But start asking yourself the question: how often does my emotional response or my emotions affect the work that I do, or affect the care that I provide, or affect the way I interact with my colleagues, et cetera, down the line of what it means to be working in an ED as a very busy nurse. And if you can honestly reflect on that and discover whether or not maybe there needs to be some work done on that side, I would look into, reading a book or two on emotional intelligence and discovering new ways or systems of thought that can help you to settle and quail the emotional response system as you're working, because that's a very important process that is often overlooked, is how does the individual handle their particular emotions, because we're all different and we all are emotional humans, and we have to learn how to mitigate that process and manage that process individually as well as collectively.
One thing I want to mention too is at a conference last week in Minnesota, and there's a place called the Center for Spiritual Living, and it is focused primarily on healthcare providers, so it doesn't have to be nursing, can be social services, anyone who might experience fatigue or compassion fatigue. There are a lot of good resources out there. I also wanted to mention, we have a comment from Barry. One way that I experience joy in my workplace is when a family feels satisfaction with their care, when I can help a patient to feel comfortable in the dying process and to alleviate stress for family members, that it's a joyful experience for them. So that's a good point.
That's fantastic.
Appreciate
that's great.
Sharing that.
In line with the conference you mentioned, Cheryl, the Institute of Healthcare Improvement is also conducting an entire conference. There's going to be an entire section of their conference related to joy in workforce vitality, and so I think everybody should, if you're interested to learn more about this and you have the expendable funds to perhaps attend this conference to learn more about joy, burnout, and its relationship in the workplace, especially if you're a hospital administrator or a practice manager. There's a lot of great resources out there that are available.
I want to mention there's a bunch of people talking about have we brought this to organizations or how they can bring it to their organizations. And I think that it's incumbent upon all of us to bring this work forward. I think what's great about how it's been presented here is that it's based in fact, and there's references, there's studies that have been done. This is not just how we feel about it. I think we all need to be change agents in our own organizations, or bring it to someone you work with that, if you're not comfortable doing that, and maybe present it during a staff meeting or to your leadership team. So that would be one suggestion that I have. And also you can, since this is being recorded, you could also share the link once you have that at a staff meeting or a team meeting for additional information so people can learn more about it. Also from another question, any resources for maintaining change or inspiration within the workplace? Big question, but there's
a lot of resources out there. There's entire companies that have been built on the basis of encouraging employee recognition, for one. The O.C. Tanner Institute is actually, I think, a component of a larger corporation that is focused entirely on how can companies recognize their employees. And so I can if anybody wants to email me, I can provide a list of resources that go more in depth. Unfortunately, I wasn't able to file those resources here for the purposes of this webinar, but there are entire companies out there that are committed to teaching this process from a top-down level, because of course we can all know it intellectually as an individual practitioner, but the real change comes from the top down. You have to get that buy-in from the executive team, and that's got to trickle down. It has to. I mean, we can start by being individually joyful and encouraging that individual experience of joy in our fellow colleagues. But if the system isn't changing, it's an uphill battle. And so I'd love to provide more resources. If anybody wants to contact us directly, I can send those resources out.
And a question, and I think you presented a lot of great research. Is there anything specifically around burnout or joy in NPs in your travels looking for reference documents?
Yeah, and that's one of the reasons why I specifically mentioned the limitation of today's webinar, is that a lot of the research that I was looking into was nursing related, and I think that's primarily a result of the hospital environment being a much more naturally more stressful environment as compared to, say, a primary care practice, though there's stress on both sides of the table there. There's just different types of stress. And so I think the literature is really inundated by the hospital system and the hospital environment. But unfortunately, I didn't find too much research on the nurse practitioner environment. That could change in the near future, and hopefully it will as we learn more about the effects of burnout with respect to NPs.
Thank you, and we are, believe it or not, at the top of the hour. I want to thank Joseph for a wonderful presentation. We had more questions than we could get to. What we will do on your behalf is we will forward the questions that we still have that are unanswered to Joseph directly. For anyone that has any questions about the initial part of the presentation with the Transforming Clinical Practice Initiative, there's my email there, Cheryl Fatibene, and Tiffany Depew as well. Feel free to reach out to us. We can certainly get you more information about TCPI, as well as if you didn't have a chance to put in a question, we can forward them on to Joseph for you. I wanted to thank everybody for attending today. We really appreciate your feedback. These are some upcoming lunch and learns that will be in the month of September. One about team-based care with NPs and embedded pharmacists, as well as part 2 of our series with Barbara Phillips about owning your own practice. So again, thank you everyone. Thanks for the great questions. We appreciate your support and all the great work that you're doing on the ground, and we hope you can join us next month. And again, thank you, Joseph, for your time. Thanks everybody.
You're welcome.
We're going to close out the webinar. Thanks very much.